So, we're going to talk about metabolically healthy obesity today and whether it's true resilience or just a matter of time before we get to heart disease risk. So, first of all, I have no disclosures. We'll talk a little bit about metabolically healthy obesity, a quick background. I'll introduce you to the MESA study if you're not familiar with it, which is where I do a lot of my work. We'll talk about a couple of the pieces that I did with MESA addressing this issue of metabolically healthy obesity. Then we'll talk a little bit about what about metabolic health in the absence of obesity and some brief conclusions. So I think many of you are probably familiar with the concept of metabolically healthy obesity. So it's this idea that there's a lot of heterogeneity, a lot of differences among those who have obesity. Some of them, have obesity and have all of those things that we've come to associate with obesity, right? They have high waist circumference, maybe diabetes, maybe hypertension, low HDL cholesterol, maybe high triglycerides, right? All of those things that we see as metabolic syndrome, which is leading someone well on their way towards heart disease and heart disease outcomes. But years ago, someone recognized that there are a lot of people with obesity who don't have metabolic syndrome, right? They don't have diabetes or hypertension, they don't have hyperlipidemia, and was really curious why, right? Is this really a group that is resilient to the effects of obesity or not? And so we get this concept of metabolically healthy obesity. And so here we're going to use the International Harmonized Criteria for Metabolic Syndrome. That's 3 or more of these criteria, as well as the WHO criteria for obesity that everyone's familiar with. So for the most part, we'll be talking about a BMI of 30 or above. And when we put those two things together, what does that tell us about the heterogeneity of risk from obesity? So when I started this work, there were really two unresolved questions about metabolically healthy obesity, or MHO. The first one was, is it a stable condition, right? If a patient has obesity now and they don't have metabolic syndrome, does that mean they're going to stay that way next year, in 5 years, in 10 years? Or are they really at risk and we need to, pay some more attention to risk factor development and maybe weight loss or weight maintenance? And the real question, what is the CVD and mortality risk from MHO? So I'm going to introduce you to the MESA study, the multi-ethnic study of atherosclerosis, where I do a lot of my work. It's a prospective cohort study. It started in 2000 with 6,800 participants from 4 self-reported racial or ethnic groups, 45 years old and older. So a really diverse group, white, African American, Asian, primarily Chinese American, and Hispanic American participants from 6 communities across the US, so very broadly geographically distributed as well. And it's a really rich resource for doing this kind of work. There are regular visits and follow-up calls and really extensive clinical assessments as well. So as I mentioned, this study started in 2000. When I did this work to begin with, there had been 5 major clinical visits. Now that's up to 7 clinical visits have been completed, including 2 more that are funded and planned in the future, as well as an entire MESA Mind component looking at Alzheimer's risk and cognitive function. So there's a huge wealth of data here that's already being collected or is going to be collected for those who are interested in using this data and to answer a variety of questions. Or if you want to add data collection to MESA as well, please let me know. And my more recent work, I added continuous glucose monitoring to visit 7 as well. So if you're interested in that, let me know. There's a huge amount of data there that we're not going to get to all of in the next few years. So for this work, we were looking at obesity. It was measured BMI at all visits, and also measured metabolic syndrome components for all visits. And one of the richnesses of MESA that makes it really important is incident cardiovascular disease and mortality follow-up, and that is adjudicated. So how did we use MESA to answer these questions? So is healthy obesity a stable condition? And when we started this work, we were starting to get a sense that it wasn't. So we were starting to get a sense from a variety of different studies that the percentage with MHO who remain that way over time is relatively low. So from these studies, Quar et al., Appleton et al., and so Rigueur et al., right, 50% or less, sometimes a lot less, remain metabolically healthy over time. So that starts to give us an inkling that maybe if someone walks in the door now and they have metabolically healthy obesity, that we need to be on the lookout over the next however many years that they're not going to stay that way. That brings up a question. If healthy obesity is not a stable condition for everyone, what determines who transitions to metabolic syndrome and who stays healthy? And some of the prior work in this area had looked at the metabolic syndrome components themselves and shown that those who have higher blood pressure and higher fasting glucose, higher waist circumference, higher triglycerides were much more likely to transition to metabolic syndrome. And of course they are. Those are what determines who has metabolic syndrome. So the closer you get to the cut point for metabolic syndrome, the more likely you are to slip over that cut point in the next few years. But I wondered, what if we step back and ask whether obesity itself is driving this transition? And there was a lot of work showing that, severity is associated with metabolic syndrome, that if you have a BMI of 40, you're much more likely to transition to metabolic syndrome than a BMI of 30. But what if we think about obesity as a cumulative impact? Something like pack years for smoking, right? It's not just that you smoke 4 packs of cigarettes a day, it's that you do that for 20 years and you end up with lung cancer and emphysema and COPD and heart disease. So, what if we think about obesity in that way? So, our two hypotheses was that transition from metabolically healthy obesity and MESA to metabolic syndrome would be common, and that both greater severity and longer duration of obesity. So that if you have a BMI of 30 and you stay that way, but you stay that way for 10 years or 15 years instead of 2 or 5 years, that's going to matter for incident metabolic syndrome as well. So using MESA, we started with the obvious. And the obvious question, right, is that obesity, right, is associated with a little more than 2 times the risk for incident metabolic syndrome compared to normal weight. Okay, great. And 48% of those with with metabolically healthy obesity at baseline transition to metabolic syndrome over 10 years. It's almost half the population. So here we see in MESA that once again, this is not a stable condition and the transition is very likely. Then getting to the real question, right? We can look at cumulative exposure to obesity. We can start with severity, right? Level 1, 2, and 3 obesity. And we find what everyone finds for the most part is that the higher the level of obesity, the more likely you are to transition to metabolic syndrome. That wasn't a surprise. What was new, and I think had been assumed by many people, but not actually tested before this, was that if you look at the duration of obesity, holding the level of severity constant, right? So assuming that the level of severity stays the same across this time period, the amount of time a person spends with obesity matter. And the answer is overwhelmingly yes. That having one visit with obesity, right, is not as bad as having 3 visits or 5 visits. And there are about 2 years between the visits here. So really we're showing that 10 years of obesity increases your odds of getting metabolic syndrome about 6 times compared to, say, 1 visit with obesity or even 2 or 3 visits, right? So spending 10 years with obesity increases your risk for metabolic syndrome quite a bit more than having it for 5 years or 2 years or 1 year, showing that really both of these things matter. And so it's not just that if you develop obesity and you stay that way and you don't continue to put on weight, then maybe you're protected. We don't see that. We see that the longer you have obesity, the higher your odds, your risk of developing metabolic syndrome as well. So some people will ask, well, what about those who didn't develop metabolic syndrome, right? So when we look across that entire 10 years of follow-up, there was a relatively small number of participants who had obesity for all 5 visits, only 24% or 251 participants who were free of metabolic syndrome throughout follow-up. So these were people who started the MESA study with obesity, spent all 5 visits with obesity, but didn't develop metabolic syndrome. So who were they? They were younger, they were more likely to be female and Hispanic, and they actually had a higher BMI at baseline compared to other participants. And so what this strongly suggests, given that they were younger, right, is that there may be an age interaction here as well, right? That it matters if you develop obesity when you're 20 versus when you're 40 or 60. And so some people may be truly resilient here, but there may also be the issue that, these participants may have actually developed obesity more recently. And since they're younger, right, maybe that age obesity interaction hasn't quite caught up with them yet. But for the most part, the majority of people seem to be at risk for metabolic syndrome from obesity, and the longer they have obesity, the higher that risk. So we found that both duration and severity of obesity are positively associated with incident metabolic syndrome, and that for the most part, metabolically healthy obesity is a transient state on the pathway to cardiometabolic disease. So this was a relatively new approach, but what everyone really wants to know is, okay, yeah, but what is the heart disease risk for metabolically healthy obesity, right? Not just do you transition to metabolic syndrome, but what does that actually mean for heart disease? So the work that had been done before this, nice meta-analysis by Eckel et al. Showing that metabolically unhealthy obesity, these are participants who had obesity and metabolic syndrome, is exactly as you'd expect, right? The risk of heart disease is, more than 2 times higher for those who have obesity and metabolic syndrome compared to those who don't. And the estimates here are fairly consistent, right? Most of these studies have about the same estimates. Okay, so we know that obesity with metabolic syndrome is, a risk for heart disease. But what about metabolically healthy obesity? What does that look like? So Zhang et al. Actually looked at metabolically healthy obesity and risk for cardiovascular disease and found that there is an association, 1.6. Okay, so that all makes sense. But if you look at these studies, there's a huge amount of heterogeneity. Most of them are on one side, but there are 3 of them actually on the other side. The confidence intervals are big. The estimates are kind of all over the place, right? 0.41, 1.26, 2.48, right? I mean, there's a lot of heterogeneity here, a lot of differences between these individual studies. And what's accounting for that? What's accounting for this study that suggests that there's no risk from metabolically healthy obesity versus the ones that say the estimates are 1.6 or even 2 or 3? So Zhang did a really excellent follow-up to this and showed that cardiovascular event risk for metabolically healthy obesity is different in subgroups compared with metabolically healthy normal weight, and that one of the things that explains that finding is the length of follow-up, how long you follow someone. So if you follow someone for only 2 years, sorry, for less than 5 years, maybe you won't see that association. If you follow them for 5 to 10 years, you're much more likely to find that association. And if you follow them for over 10 years, you're overwhelmingly likely to find an association between healthy obesity and heart disease. And that the heterogeneity, those differences between the studies, are actually finally reduced when you look across 10 years of follow-up or more. So this appears to be a follow-up issue. And if you follow people long enough, you're going to see the risk from healthy obesity in the heart disease outcomes. Okay. So we followed this up with what is the heart disease risk from healthy obesity in MESA and looked at what is the gap in all of these studies. And the gap in all of these studies is that they all started at baseline, right? Whether it's Framingham or Jackson Heart Study or any of these studies, they all started at baseline and looked at metabolically healthy obesity at baseline, followed them up over time for heart disease. But we already showed that up to 50% of these participants might have transitioned to metabolic syndrome in the follow-up period. So does that explain this risk? So that's what we wanted to look at. So we hypothesized that those with metabolically healthy obesity at baseline will be at intermediate risk for heart disease events between estimates for those with healthy normal weight and those with metabolically unhealthy obesity. The transition to metabolic syndrome will explain the heterogeneity in heart disease risk for those with MHO at baseline, and metabolic syndrome duration will have a significant positive dose response with heart disease, and that the relationship between obesity and heart disease will be substantially mediated by metabolic syndrome, explaining the lack of an independent heart disease association for obesity when adjusted for those metabolic syndrome components. So let's take a look at what that means. So here we have, as you'd expect at baseline, we've got healthy normal weight, healthy obesity, and obesity with metabolic syndrome. And you can see that those with healthy obesity at baseline, there's some indication that there might be a slightly higher heart disease risk, but it's not significant, and it's pretty close to that null value. And then, as everyone expects, obesity with metabolic syndrome is increasing heart disease odds over 2 times. But we already mentioned that 48% of the people in this healthy obesity group transition to metabolic syndrome in this follow-up time period. So what does that look like for them? And when we look at this transition across follow-up, we can see very clearly that those who are healthy, normal throughout, right, are our reference group. Those who maintain healthy obesity throughout the follow-up actually don't appear to have an increased risk at all. But those 48%, or almost half of the population, who transition to metabolic syndrome have a significantly higher risk for heart disease. And we already showed that obesity itself, both the severity and the cumulative duration, is driving, at least in part, this transition. And of course, those who had unhealthy obesity throughout have a higher risk for heart disease. So just as we did for obesity, we also wanted to show this dose response for duration of metabolic syndrome. And so here we have as a reference group, no metabolic syndrome. So these are all participants in MESA who had obesity. The reference group here is no metabolic syndrome across follow-up, 1 visit of metabolic syndrome, 2 visits of metabolic syndrome, and 3 or more visits of metabolic syndrome. And you can see that exact same response is that the longer you have obesity, the more likely you are to transition to metabolic syndrome. And the longer you have metabolic syndrome, the higher your risk of developing heart disease. Suggesting that this is kind of a matter of time, right? The longer you have obesity, the more likely you are to transition in that next level of risk. And the longer you have metabolic syndrome, the more likely you are to develop heart disease risk as well. So the next piece we wanted to look at is we showed that obesity is associated with metabolic syndrome. And nobody's really surprised by that, but we showed that this duration piece, this cumulative exposure piece, matters also. We showed that metabolic syndrome and metabolic syndrome duration is associated with heart disease. And then we showed that 62% of the relationship between obesity and heart disease goes directly through metabolic syndrome. So when people talk about looking at obesity and heart disease and saying, when I adjusted for all these things like hypertension and diabetes and hypercholesterolemia, I didn't see an independent association with obesity. This is what they're talking about. But we don't expect to see an independent association because obesity is causing those metabolic syndrome components, which is causing heart disease. It's not independent at all. It's a causal relationship where obesity is leading to metabolic syndrome and then leading to heart disease. And 62% of this relationship is through this pathway. So from this work, we concluded that transition from MHO to metabolic syndrome during follow-up is common. The failure to account for transition is likely explaining those different estimates for metabolically healthy obesity in those different studies. And MHO is not a stable or even reliable characterization of lower clinical risk. So what we learned from MESA is that healthy obesity is a transient condition, and few individuals are actually resilient to obesity given enough time. Healthy obesity is a risk factor for heart disease in almost half of individuals across 12 years in MESA. Continued obesity is a major contributor to unhealthy risk factors for heart disease, and that weight loss or maintenance, depending on the population you're looking at and the patient you're looking at, and certainly management for heart disease risk factors should be recommended to all individuals with obesity. Some of the caveats here are potentially older adults or those who have comorbidities such as heart failure, kidney disease, things like that, where weight loss may not be recommended, and that weight loss or maintenance should be individualized for patients and individuals. But certainly finding ways and strategies for people to not continue to gain weight is important as well. So what happened since then? There have been dozens of confirmatory papers in multiple different cohorts across different populations and geographies. There's really, really excellent and great work coming out of Korea and China that can speak more to groups underrepresented in Western countries, showing that those who transition from metabolically unhealthy back to healthy, or those who transition from obesity back to a normal weight actually have significantly reduced risk. That is much harder to do in the US as we tend to continue along the obesity epidemic. But these wonderful papers from Korea and China are showing that going backwards in that obesity and metabolic syndrome pathway also reduces risk. And they're also showing risk for underweight groups as well that we just don't have represented as well in the US. So after we published our paper, Opio et al. Came out with an even bigger meta-analysis, combining even more of these studies. And we see about the same estimate, even as we add more studies, but still a lot of heterogeneity. They also add an overweight piece. So here they show that metabolically healthy obesity has an odds ratio of 1.58 for heart disease risk. They show that overweight has an odds ratio of 1.34. So here we get an even better sense of this dose response, that even metabolically healthy overweight may be associated with cardiovascular events, but the metabolically healthy obesity has an even higher association. And we still see this heterogeneity when we don't look at the transition over time from healthy obesity to metabolic syndrome, knowing that, up to maybe half of the participants in every one of these studies may have transitioned, depending on the population and the age. So Abiri in 2022 did a really excellent follow-up to this, looking at a meta-analysis of transitional metabolically healthy obesity status and CVD incidence. And you can see that this seems to explain a lot of the heterogeneity. When you look at that transitional status, we see this higher heart disease risk. with the potential exception here of Hossein Pana, which is a younger population out of Iran, and so it's not clear whether that younger population hasn't hit a prime age for risk for this, or whether they had a smaller number of events. Interestingly, the length of follow-up follows along this going up. And so the studies at the bottom had shorter lengths of follow-up, with the studies at the top having longer length of follow-up. And with that exception of, Guo and Hossein Pana, you mostly see this response where the longer you look at follow-up, the more likely you are to see that heart disease risk increase, especially with transition to metabolic syndrome from metabolically healthy obesity. So then there's this other concept. There's this concept of metabolically unhealthy normal weight, right? What does any of this mean for someone who doesn't have obesity, for someone who's in the normal weight or the overweight category? And I was starting to do some work on visceral fat and heart disease risk. And I wondered if excess adiposity, visceral fat, specifically the fat that ends up inside the body cavity and wrapped around your organs if you have enough of it, and is highly related to the fat that lines the arteries for atherosclerosis. Visceral fat might help explain metabolic syndrome in the absence of obesity. So when we have participants who have a healthy weight or just overweight, but they have metabolic syndrome, what explains that? And is it also excess adiposity? So here I turn to a couple of different studies, the Iris family study and the Jackson Heart study. So in the Iris family study, we looked at subcutaneous tissue and visceral adipose tissue and wanted to see whether either of these things would start to explain why some people have metabolic syndrome and some people don't. So here on the y-axis is subcutaneous fat. On the left, we have the normal weight group. In the middle, the overweight group. And on the right, the group with obesity. And then the normal, sort of metabolically healthy group and those with metabolic syndrome. And you can see that subcutaneous fat really doesn't differentiate the healthy versus unhealthy participants between the different BMI categories. And not surprisingly, it does very well differentiate those with normal weight, overweight, and obesity. And this is not surprising given that subcutaneous fat is actually the largest contributor to BMI because it is the largest depot for fat mass. But somewhat disappointing, and it explains why when you look at BMI alone, it doesn't necessarily differentiate within the BMI categories who's going to develop metabolic syndrome. However, when we look at visceral fat, we do see that it differentiates or discriminates between those with metabolic syndrome and those without inside each of the categories, BMI categories. And this is not entirely surprising in context. Visceral fat has been far more associated with insulin resistance, with diabetes, with most of the heart disease risk factors and outcomes you could think of, for a lot of different reasons. Visceral fat is more hormonally active. It has a higher relationship with inflammation. And so the visceral fat is really, doing something different than the subcutaneous fat is in the body. There's still some outstanding questions here. For instance, you see that the overweight metabolic syndrome group has about the same level of visceral fat as the healthy obesity group, right? So there are other components here that explains why someone who has overweight develops metabolic syndrome at a higher visceral fat. But at that same level of visceral fat, someone with obesity maybe doesn't, right? So there's still a lot of heterogeneity and individual risk here. And here we didn't really get the opportunity to look at duration. And so it could be that someone who has overweight for 20 years is at more at risk for metabolic syndrome than someone who has overweight for just a couple years or obesity for just a couple of years. So taking this further, we really wanted to look at this relationship for visceral fat and whether it was independent of the BMI or obesity association. So here on the left, we have baseline visceral fat quartiles, and you see that increased risk the higher the visceral fat goes. We also looked at change over time. So even across 2.5 years in this relatively young population, you can see that those who had an increase in visceral fat had an increase in transition to metabolic syndrome, whereas those who decreased in visceral fat maybe had a slightly lower risk. And on the right here, you can see that baseline normal weight, baseline overweight, and baseline obesity have the relationship that you'd expect. And these are adjusted for each other. So it means that even when you account for baseline BMI, visceral fat is actually mattering in who transitions to metabolic syndrome and who doesn't. And change in visceral fat matters also, even at the same BMI. We followed this up with a study in Jackson Hart and really wanted to look at that absence of obesity. We're really looking in normal weight and overweight participants and whether visceral fat matters there as well. So here on the left, we have visceral fat. The black circles are metabolic syndrome, and the open squares are type 2 diabetes. You can see that the association for visceral fat is much stronger than that for subcutaneous fat or body mass index next to them, which is not that surprising. And you can also see some of these insulin resistance issues, right? Insulin resistance matters for these kinds of things and is possibly, very likely being driven by obesity and possibly visceral fat as well. And then over on the right, you can see that physical activity doesn't actually seem to be doing too much. That's one of the questions we get a lot here is, if we see someone that has obesity, but they're very physically active, are they protected from metabolic syndrome? There's some nice work showing that physical activity, but especially cardiorespiratory fitness, may matter about whether someone transitions to metabolic syndrome and heart disease risk or not. But for the most part, in our work here, we found that the physical activity doesn't explain the obesity, metabolic syndrome, ectopic fat metabolic syndrome, cardiovascular disease results. And that could be because in these studies, we don't have great measures of physical activity, and we certainly don't have great measures of cardiorespiratory fitness. And those two things are not always the same. And so it could be a measurement issue, but it could also just be that the obesity and ectopic fat relationships are much stronger than the physical activity relationships here. Putting all of these pieces together, we're increasingly learning that excess adiposity is important for metabolic health at every level of BMI. And you might ask, well, what about those who are underweight or at the very bottom of the normal weight category? That's an interesting question, and we're finding that in older adults, this may matter even so, that in older adults, the transition from subcutaneous to visceral fat happens more and the loss of lean mass. So you can have someone who's a normal weight or even potentially leading towards underweight and frailty, but the fat mass that they have is increasingly visceral fat and not subcutaneous fat. And so you can actually have, sarcopenic obesity, where someone has a higher rate of obesity and lower lean mass and losing that functional mass. And you can have adults that are actually sort of on the lower normal side or even underweight, but they may actually have a higher proportion of visceral fat than you expect, given that the aging process tends to take people from subcutaneous to visceral and ectopic fat. And so that the distribution of fat mass may actually be playing a role there too. And where that fat is found plays a large role in determining whether that fat is dysfunctional or not. And we're also seeing that the metabolic context in the US is pretty unhealthy for the majority of the public and contributing to metabolic dysfunction, even when obesity isn't present. We're seeing an increasing rate of unhealthy normal weight, people who don't have obesity but have metabolic syndrome, people who don't have obesity but are, have prediabetes or heading towards diabetes. And so this ectopic fat, this, dysfunctional fat and metabolic health, even without obesity, is really important at a population and individual level. And this suggests that structural changes are needed to prevent further increases in metabolic disease population wide. That if we really want to tackle the obesity epidemic and the highly related metabolic dysfunction and diabetes epidemic, that we really need to address these at a larger, more structural and functional level. Um, but it's also a really interesting time to be working in obesity, and there are so many changes in the context right now. It'll be really interesting to see how those impact this kind of work and what that's going to mean for heart disease risk going forward. I have a huge number of acknowledgments here, a ton of co-authors and collaborators who have been just wonderful. The Metabolically Healthy Obesity work started when I was a postdoc, so huge thanks to NHLBI for their training grants. MESA, Jackson Hart, and Iris Family Study are funded by NHLBI by a large number of contracts and grants that keep these enormous studies running and fund the variety of sites and data coordinating. As always, the staff and participants of these big cohort studies are absolutely essential to doing this kind of work, and them volunteering to be parts of these studies makes all of this work possible.